And I know you, once they have the baby, you love this process too, of helping make sure the baby and then the kids are healthy. And so how do you work with kids?
With kids, so infants at that stage, right? Once again, that's about just really making sure that the bond between mom and baby is good, and basics like breastfeeding are taking well, a bit of additional training in that type of specific support. Really important to make sure that mom's recovery is going well. A lot of the times, you know, if there isn't good support or just, you know, good nourishment and care, then it's a big transition. Like you go from having a kid to not having a kid, and that's often huge, right? So once again, just really being someone who checks in regularly, you know, even if everything's okay, just saying, I'm here, please let me know, right? And I do house calls for those clients as well. I like to go to them and really just feel like at home, they've got attention, they've got care, and we're making sure that they're okay. So then, you know, as kids grow, really it's about intervening only when you need to, right? Because kids are really vital and they should be really healthy. It's about giving parents a lot of information so that they feel they can confidently care for their kids, that they understand from a diet point of view, you know, how do I build a healthy diet? How do I build a healthy eater? I love talking about that. So food introduction with kids when they're 4 to 6 months, I love working with that. Helping build a healthy immune system so that when they get sent out into the world, into daycare, into school, they're not bringing everything home. I've seen that be a miserable transition for families. So I like to do a lot of preventative work with kids, right? Once again, I think it's a lot about information and resources and helping parents understand what they can do. Because once again, a lot of the time I just see parents who sort of like, I don't know what to do. I go to the walk-in and it's very quickly given the solution, but they don't know why, right? It's really important for parents to feel confident and adjusted and supported once again. So a lot of it is informational.
And what are some of the health issues that kids sometimes run into that you often find yourself helping with?
So I would say in my practice, because I work with lots of pregnant women and see them through that transition, I just do a lot of basic general well child checks. So like looking at developmental milestones and feeding and immune system development. When you get into school-age kids, I find generally a lot of kids, I'm seeing kids that are generally healthy, but when the school year starts up, the immune system starts to get challenged and they get sick all the time, and then everybody in the house gets sick. Naturopathic medicine has a lot to offer with regards to prevention, but also acute treatment as well, right? Minimizing the use of antibiotics and the side effects that has, and you know, all that kind of stuff. See lots of skin concerns in kids, eczema probably the most, which I think is really driven from a dietary place and an immune imbalance. So it's about shifting that and helping develop a better system that way. Asthma is not uncommon, or, you know, lingering respiratory issues, digestive issues, and also sometimes like anxiety and sort of stress in kids. I've seen that lots, right? And helping, you know, work with families and work with the child to understand, you know, why that's actually happening and what can they do on their own to help, you know, mitigate that, right? But that's predominantly what I see in kids.
That's good.